Good day, I'm Yvonne from BSN Section N15, and now I'm going to be assessing the neurological system. So it's an examination of the neurological system, which comprises the assessment of the mental status, including the level of consciousness, the cranial nerve, reflexes, motor and sensory functions, and some of the parts of the neurologic assessment are performed through the health assessment like mental status assessment, observing the appearance, and cranial nerve functions. So the main objective is to obtain an accurate nursing history of the client's neurologic system and to determine any deviations of abnormal findings of the client's nervous system functioning, and lastly to formulate valid nursing diagnosis, collaborative problems, and referrals. So for the preparations, we need to assemble the equipment first: the salt, the sugar, the lemon juice, the quinine flavors, and the percussion hammer, tongue depressor, wisp of cotton to assess light touch sensation, test tube of hot and cold water for skin temperature assessment, pins or needles for tactile discrimination. Then, introduce yourself and verify the client's identity. Explain to the client what we're going to do, once it's necessary, and how the client can cooperate. Then, of course, perform hand hygiene and observe the appropriate infection control procedures. Then lastly, provide for client's privacy. So, inquire if the client has any history of presence of pain in the head, back, or extremities, as well as onset and aggravating and elevation factors. Then disorientation to time, place, or person, and speech disorder, any history of lost consciousness, fainting, convulsions, trauma, tingling or numbness, tremors or tics, limping, paralysis, uncontrolled muscle movement, and loss of memories or mood swings, and problems with smell, vision, taste, touch, or hearing. So for the language, if the client display difficulties speaking, point the common object and ask the client to name them. So I'll get some of objects here and I'm going to let the client identify it. So sir, can you please identify what's this?
Scotch tape,
Really? This
makeup brush,
and this?
watch,
Ah, good. Then, ask the client to read some words and to match the printed and written words with pictures. Sir, can you read this?
Dork Diaries, Once Upon a Dork.
What can you see in this picture?
A princess with a crown.
Wow, that's great. Then, ask the client to respond to simple verbal and written commands. So, sir, kindly point your toes. Great. Then, raise your left arm. Oh my God, good. Then, for the orientation, determine the client's orientation to time, place, and person by tactful questioning. Then, ask the client the city and state of the resident, time of day, date, day of the week, duration of illness, and name of the family. So sir, what city are we in now?
I am in Bukwan City at Rosewood, Yvonne's residence.
What is the time of the day?
The day is today is 3 p.m. at the afternoon.
Sir, can you name your father and your mother?
My mother's name is Ruby Del Rosario and my father's name is Lain Maureen Marangit.
Oh, really? So the patient is able to comprehend the details. Then, more direct questioning might be necessary for some people. So sir, can you tell me where are you now?
I am here right over you. In front
Where?
of you. I am here at the hospital.
Great. So sir, what day is it today?
It's Thursday.
Great. Uh, so for the memory, listen for lapses in memory, then ask the client about difficulty of with memory. Then if problems are apparent, three categories of memories are tested, which is the immediate recall, recent memory, and the remote memory. To assess the immediate recall, we need to ask the client to repeat a series of digits. So sir, can you repeat? 743.
743.
So gradually increase the number of the digit. Sir, can you repeat? 7435.
7435.
Again, another one. 74356.
74356.
Okay. Then start again with a series of 3-digit number, but this time, ask the client to repeat them backward. So sir, repeat them backward. 743.
347.
Oh my goodness. So to assess their recent memory, ask the client to recall the recent event of the day, such as how he got to the clinic, and this information must be valid. So sir, how did you get here?
I got here using my skateboard.
Skateboard, you're a skater. Oh my god. And then ask the client to recall information given earlier in the review, and the name of the nurse. Sir, do you know me? What's your name?
Yes, I know you. You are my nurse for today. You're Yvonne Collado.
Oh my god, you know me. Then provide the client with 3 facts to recall: a color, an object, an address, a 3-digit number, and ask the client to repeat all 3. Later in the interview, ask the client to recall all 3 items. So, can you identify the 3 objects that I've given to you earlier?
It was an scotch tape. Then makeup brush.
And
Then a watch.
oh my god! Then to assess the remote memory, ask the client to describe a previous illness or surgery. Do you have any history of illness, and have you undergone surgery before?
I don't have any history of illness and I don't have any surgery before.
Then for the attention span and calculation, test the ability to concentrate or attention span by asking the client recite the alphabet or to count backward from 100. So, sir, can you recite the alphabet? Just recite.
A, B,
Faster, close.
C, D, E, F, G, H, I, J, K,
Normal.
L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z. Amen.
Great. Then, test the ability to calculate by asking the client to subtract 7 or 3 progressively from 100. So, sir, can you subtract 7 progressively from 100?
93, 86, 79.
Great. And then, subtract the 3 progressively from 100.
97, 94, and 90. Wow.
Oh my goodness, you're a mad genius. So in the level of consciousness, apply the Glasgow-Coma scale, eye response, motor response, and verbal response. So for the cranial nerve, we need to test the cranial nerve, the olfactory, auditory, the glossopharyngeal, the vagus, the assessor, and lastly, the hypoglossal. Then for the lip reflexes, test the reflex using a percussion hammer. Compare one side of the body with the other to evaluate the symmetry of the response. So, and the bicep reflex, partially flex the client's arm at the elbow and rest the forearm over the thigh, placing the palm of the hand down. Then, place your thumb on your non-dominant hand horizontally over the bicep tendon. Then deliver a blow with the percussion hammer to your thumb. Then observe the normal slight flexion of the elbow and feel the biceps contracting through your thumb. So for the tricep reflex, flex the client's arm at the elbow and support it in the palm of your non-dominant hand. Then you observe the normal slide extension of the elbow. Then for the brachioradialis. So for the
Brachioradialis.
brachioradialis reflex, rest the client's arm in a relaxed position on your forearm or on the client's own leg. Then deliver a blow with a percussion hammer directly in the radius of 2 to 5 centimeter. Then observe the normal flexion and supination of the forearm. The finger of the hand might also extend it slightly. Then for the Achilles reflex, with the client in the same position of the lateral reflex test, slightly dorsiflex the client's ankle by supporting the foot lightly in your hand. Sir, give me your... Then, deliver a blow with a percussion hammer directly into the tendons. Then observe and feel the normal plantar flexion of the foot. Then for the plantar Babinski's reflex, use a moderately sharp object such as the handle of the percussion hammer, a key or a dull end of the pin or applicator stick. Then stroke the lateral borders of the sole of the client's foot, starting at the heel, continuing to the ball of the foot, and then proceeding across the ball of the foot towards the big toe. Here, we're going to observe the curling of the big toe. Normally, the toes would be bent forward and it's negative Babinski, but if there's sign of the fanning, then it's a positive Babinski. So let's start it in the heel. Then observe the response. Then for the motor function, gross motor and balance test, walking gait, ask the client to walk across the room and back and assess the client's gait. Sir, kindly stand up. Kindly walk from this point to this point and then go back to your position. Okay, down. So for the Romberg test, ask the client to stand with feet together and arms, resting at the side, sir. Then first with open eyes. So you will gently push the patient. Then with closed eyes. Then, standing on the one foot with closed eyes. Sir, can you close your eyes? And then stand one foot and then the other. So, stand. Not like that. Like that. Okay. Close eyes. Okay. Make sure you're standing to the client. You're standing close to the client. Then the other part. Alright, you have a very good balance. Then for the heel-toe walking, ask the client to walk a straight line, placing the heel 1 foot directly in the front of the toes and the other foot. Sir, kindly walk with your heel-toe. And then, for toe or heel walking, ask the client to walk several steps on the toes and then on the heel. Go back, sir. Alright. Go back to your position. See it? So, for the finger to nose test, ask the client to abduct and expand the arm of the shoulder height and rapidly touch the nose alternately with one index. Sir, kindly expand your arms. Then, rapidly touch your nose alternately with one index. Can you do it, sir? Go.
Right or left?
Right, left, right, left, right. Then have the client repeat the test with eyes closed if the test is performed easily. Sir, can you close your eyes? Then left, right, right. Oh my God. Right, left. Okay. So for the alternating supination and proportion of hands on knees, ask the client to pat both knees with palms of the hand and then with the back of the hand, alternately at an even increasing rate. Sir, can you okay, give me this. Can you pat both of your knees?
Up, down,
Up, down,
up,
up, down, up, up, right, down, down, up. Okay. So for the finger to nose and to the nurse finger, ask the client to touch the nose and then your index finger, then held at a distance about 45 centimeter at a rapid and increasing rate. Sir, can you touch your nose? Touch this. Rapidly. Then, fingers to fingers. Ask the client to spread arms broadly at the shoulders height and then bring fingers together at the midline. First with eyes open, then closed. Sir, can you spread your arms? And then go. Okay, with eyes closed. Then fingers to tongue, same hand. Ask the client to touch the fingers of one hand with the thumb of the same hand as rapidly as possible. Sir, can you do it? Go. Alright. Then for the fine motor test for the lower extremities, ask the client to lie supine and to perform this test. First is the heel down, opposite shin. Ask the client to place the heel of 1 foot just below the opposite knee and run the heel down to the shin. So, sir, heel of 1 foot just below the opposite knee. Okay, the other one. Alright. So for the toe or ball of the foot to the nurse finger, ask the client to touch your finger with the large toe of each foot. Sir, can you touch this with your big toe? Oh my God. Another one. Then let's proceed to the light touch sensation. Compare the light touch sensation of the symmetric areas of the body. Then ask the client to close the eyes and to respond by saying yes or no whenever the client feels the cotton wisp or the touching skin. Then lightly touch one specific spot and then the same spot of the other side. Then test areas on the forehead, cheeks, hand, lower arm, abdomen, foot, and lower leg. Then check the distal area of the limb first. Close.
No. Ah, yes, that. Symmetric, yes. 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 Yes.
Okay. So, if areas of sensory dysfunctional are found, determine the boundaries of sensation by testing response approximately every 2.5 centimeter in the area. Then make a sketch of the sensory loss area for recording the purposes. Then for the pain sensation, assess pain sensation. Then for assessing the pain sensation, ask the client to close his eyes and to say if it's sharp or dull, or if you don't know, then alternately use the sharp and dull end of the sterile pin or needle. Lightly pick a designated anatomic area of at random. The face is not tested in this manner. Then allow at least 2 seconds between each test. Close your eyes, sir. Sir, what do you feel?
No, sure.
Right. This.
Done.
This.
Done. Sharp.
This. Also this.
Sharp.
Lastly.
Sharp.
Okay. Then for the temperature sensation, touch skin areas with test tubes filled with hot or cold water. Then ask the client to respond by saying whether it's hot or cold, or if you don't know. Oh, sir, kindly open your palm. So,
Cold. Cold. Hot. Hot. Cold.
okay. So, for the position of kinetic sensation, commonly, the middle fingers at the large toes are tested for the kinetic sensation. To test the fingers, support the client's arm with one hand and hold the client's palm together. To test the toe, place the client's heels on the examining table. Since I don't have examining table, because we're low budget here, I'm just gonna use my thighs. Then ask the client to close his eyes. Then grasp the middle finger or a big toe firmly between your thumb and index finger. Then exert the same pressure on the both sides of the finger or toe while moving it. Then move the finger or toe until it's up, down, or straight. Then ask the client to identify the position. Sir, can you identify?
Straight. Down. Straight. Up. Down.
Okay. Let's move on to the fingers. Can you give me your finger? Oh my God, you have a nice hand. Sir, can you identify? Eyes closed.
Up. Down. Straight. Straight. Down.
Okay, for the tactile discrimination, for all the tests, the client's eyes need to be closed. 1 and 2 point discrimination, alternately stimulate the skin with 2 pins, and then with 1 pin. Then ask whether the client feels 1 pin or 1 or 2 pin pricks. So, sir, close your eyes. Identify if it's 1 or 2 pin pricks.
One. Two. One. Two.
Alright. So let's move on to stereognosis. Place a familiar object such as keys, paper clips, or coins in the client's hand. Then ask the client to identify them. Then, okay. Sir, kindly close your eyes. Don't peek. And identify what object is this.
Watch.
Really? How about this?
Nail cutter.
This.
Fetty pen.
Alright. Then if the client has a motor impaired of the hand and is unable to manipulate an object, write a number or 3 on the client's palm using a blunt instrument and ask the client to identify it, but we don't need to do that anymore. And so for the extension phenomenons, simultaneously stimulate 2 symmetric areas of the body such as the thigh, the cheeks, or the hand. Identify where do I put my fingers.
Thigh. Cheeks. Arms.
Good. Then, we're done. Then lastly, document findings in the client's record. That will be all. Thank you.